Welcome back. The time now 7:39. Across the country, the amount of people dealing with mental health challenges continues to climb here in San Diego. Jackson House is working to help those who are struggling. CEO and Dr. Bruce Figuered joins me now to weigh in on the state of mental health in our country as well as here in San Diego. So, Dr. Bruce, tell me a little bit about, first of all, what you're seeing as far as mental health and addiction are going right here in San Diego.
Yeah, I mean, the stories are on the news every day. You know, like numbers continue to rise, whether it's depression, anxiety, or addiction issues. And as those numbers rise, you know, the need for effective services is really, you know, kind of at the forefront, and it matches the need.
Yeah, and that's a little bit about what Jackson's House does.
Yep.
So tell me about Jackson House and how you guys help people who are struggling.
Sure, yeah. Jackson House was started 7 years ago, and we started with one residential mental health facility. And over the last 7 years, we've grown to facilities, you know, throughout Southern California, and now also expanding into Oregon. So we operate as an in-network facility who treats both mental health and addiction problems. We are in network with every commercial insurance company. So what that does is it really allows people access to the care that they need. And we also have residential and outpatient services at West Coast recovery centers.
And so, I mean, we talk about it all the time. I mean, you see a lot of the homeless issue here in San Diego tied to addiction and mental health. Is that what you guys are seeing as well?
Yeah, I mean, the consequences of addiction and mental health problems left untreated can be really severe. You know, people suffer consequences in terms of their relationships with their families, the problems at work, or their finances. And so as those problems continue to mount, unfortunately, you know, those problems mount, but a lot of people don't seek out the help, you know, because they're concerned that they'll be judged or there's some stigma associated with it. And really, you know, if you tore a ligament in your shoulder, or you had diabetes or some other condition, like a medical condition, you would never, not never, but most people wouldn't avoid seeking treatment. But with addiction and mental health, like, it's just not that way. I mean, people avoid it, and I think that it's something that they really can't get help for, or that they'll be stigmatized if they did get help.
And so what should somebody look out for if they want to get a friend or a family member help? Like you say, a lot of times that's difficult to even approach that topic.
Yeah, I mean, you have to know that we have treatment centers with people that are passionate about helping people. And we are accessible, and we have levels of care from residential to outpatient services. And really, if somebody is thinking about help, or you have a family member that's concerned about a loved one, really just make the call. You know, make the call to us. We can talk to, you know, whoever it is that calls and talk about the services that are available. It doesn't have to be something that's scary, right? I mean, it's something that's available, something that's there. Everyday people just trying to help people, you know, get through the struggles.
Yeah, because I think everybody thinks, oh, well, we're gonna have to do this whole intervention, and that's the way it used to be, but it doesn't have to be quite that dramatic anymore.
Not at all. You know, like at West Coast, we have outpatient services, and we also have supportive housing. So someone can either live at home and then come just for outpatient for mental health or addiction, or if they're in need of something, you know, at a higher level of care, we have residential treatment centers specifically for addiction and specifically for mental health. And so the accessibility and the individualized care for people is there.
Okay, and it's important for people to utilize that if they need it.
Of course, yeah.
All right, Dr. Bruce Figuered, we appreciate you coming in, sharing a little bit about Jackson House and what you guys do, and hopefully we'll get some people who are on the fence and make that decision to get some help.
Yeah, just make the call, and we can talk you through it.
All right, thank you.
Thank you.